As Cynthia mentioned earlier, the Ontario government is overhauling health care, taking control away from regional bureaucracies and creating Ontario Health, a central agency that they say will streamline care. Under the new system, healthcare providers like hospitals, home care, mental health care would be organized into teams. Each team would be responsible for 300,000 Ontarians.
The hospitals of Ontario are quite excited about the news made by the Minister today and the opportunities that it presents, and they're anxious to roll up their sleeves and get to work. You can have 1,000 performance indicators, you can have 22 oversight bodies, you can have all of the agencies, but you can still have a situation where hallway healthcare emerges over a 3-year period and nobody saw it coming, because that's exactly what happened. You have all of this administrative oversight, but it missed the big picture. So that's a sign of something not being in balance. It's a sign of the need to correct it and allow the system to focus better on its performance.
Healthcare costs make up 42% of Ontario's entire budget. Minister of Health Christine Elliott says the goal is to put more frontline healthcare workers to work while reducing bureaucracy. Agencies being rolled into the new single entity include Cancer Care Ontario, eHealth, and Trillium Gift of Life. Right now I'm joined by Professor Raisa Deber from the University of Toronto, a healthcare policy researcher. First and foremost, how does this affect the patient directly? How will this affect going to the doctor, going to the hospital?
It's extraordinarily difficult to figure it out from what has been said so far, because the key thing to realize about healthcare in Ontario is two things. First of all, it's private, it's not public. Hospitals are not-for-profit private organizations. Doctors are not civil servants. So, the question is, does this change mean that they're having more control from the center over these private organizations that happen to get public money? The second thing is that under the Canada Health Act, all that has to be paid for is doctors and hospitals. So you can do more, but you don't have to. And many of the problems that are being pointed to are problems when you need care that is not included in this definition of what has to be paid for. And I can't see anything about whether or not they are going to extend what they're paying for.
So based on what you've seen so far and the idea of creating these teams, has anything like this existed elsewhere as far as you know?
Okay. All over the place, and we have those teams now. I mean, that's what they call family doctors and family health teams, and there's nothing in it about where primary care fits in. And the other thing that's very important to keep is that people aren't all the same. So if I happen to be somebody with a rare disease or a serious condition, I need very different sorts of care. Then fortunately I'm pretty healthy and I don't need anything more than my family doctor. So if you're talking about teams, what are you going to do if you have a child with cystic fibrosis? Are you really going to have enough expertise in these teams to do it? You look at Hospital for Sick Children. The people at Sick Kids, in a group of 300,000, are you going to have the expertise? And what are you going to do with something like Sick Kids?
People are going to want to compare this to eHealth and the idea that we're going to create something centered around one patient. How does this compare?
Well, there is always the thing but the question is, how do you make sure people get the care that they need and don't get care that they don't need and get care that's high quality? And what you need depends very much on what your health status is. And a lot of the things that you need don't have to be paid for. That's one of the reasons you have hallway medicine. Because if I'm in the hospital, my physio is going to be paid for, my drugs are going to be paid for. If I'm out of the hospital, they don't have to be. Mental health. You don't have to pay for any mental health services unless they're delivered by psychiatrists. And I was trying to see in this what they're going to do about all of these services that are falling through the cracks, which is where I think most of the problems are.
There's going to be plenty of time to try and analyze and comb through this, and I'm sure you're going to be spending plenty of time doing that.
Yes.
Thank you very much for joining us.